And I'm Pavel Stodulka at Gemini Eye Clinic, the Czech Republic, and I'm going to perform the laser-assisted cataract surgery, including laser arcuate keratotomy on this 45-year-old lady, which is just ready here and waiting for the surgery. So welcome everybody, and we are going to start the surgical case right now. So I'm just asking the patient to open her eye and follow the light right in the middle. So we are going to just have the patient interface ready, and I'm coming with this disposable ring towards her eye just to put it right onto her eye. So we are coming close towards her eye and she is following the light. So we have just attached the ring. We put one drop of eye drops into her eye and just straightforward move the patient under the laser. We don't use speculum to dop the patients regularly, so we found it just more straightforward. And now we are coming towards her eye. Pěkně doprostřed se dívat pořád na to světelka, ty světelka trošku zmizí za chviličku. Okay, and she can just observe the aiming beam and she's going to feel a little bit of pressure, malinko to zatlačí, and then we are just getting to the green and close the click, and that's the docking is ready. And this VICTUS femtosecond laser is a unique platform because it has an intelligent set of sensors which guides this patient interface and enables to follow the different forces. And here you see the monitor which monitors the side pressures, and we are exactly in the middle in the green, so we can move for the planning. And first step is just to mark our pupil, so the laser knows where the pupil lies, and after that we are going to mark anterior capsule on this OCT image, and as soon as the anterior capsule has been marked, we shift the focus of the OCT towards the posterior capsule. You see a nice resolution of this OCT, and we repeat the same procedure at 90-degree axis. So again we get the OCT image at the 90-degree axis. We just fine-tune the pressure, so this is the middle, periphery, and as soon as we have this marked, once again we shift the focus of OCT to the posterior aspect of the lens and finalize marking. So the next step is to just mark the capsulotomy. So we see the 360-degree circumference of the capsula just marked with all over the entire circumference of the capsulotomy. And as soon as we have this ready, we accept the data and we just keep the vertical pressure in green. The same time we are keeping the lateral force in green. So this is a unique portion of this laser, that we can also monitor the lateral pressure. So as soon as we are confident, we just push the start the procedure button and it's all getting ready for the surgery. Here we have a green line coming for capsulotomy, which is going to last something like 15 seconds, and the capsulotomy has been just finished. And the next procedure is lens fragmentation. So we see already some bubbles, very few bubbles in the eye, so we can start the lens fragmentation, and you see very nice the lens fragmentation pattern working within the lens, which has been just finished. So now we just need to release the foot switch, open the clip of the eye and go up for a little higher pressure to get it in green again, to finish the last laser step of this surgery, which is going to be the arcuate cut. So we are ready, getting the green frame, so everything is just ready for the surgery. We just are unsure about the pressure and we can continue the surgery. So it's all going fine. We have our pressure sensors all in green here and here. Green and yellow is very nice, acceptable, and within like 5 seconds the arcuate incisions were done. So that's the laser part of the procedure. We release a foot switch which we just push during that minute, and then the next step is just to undock the patient. So we go slowly down from underneath the laser, and the laser part of the procedure has been finished. The patient has been prepared for the laser-assisted cataract surgery with the laser procedure itself. So you saw the docking itself was quite straightforward, and the procedure takes about 2-3 minutes, and we can now walk the patient towards the next room. And this is a Stellaris PC with its handpiece, and we are getting it inside, and we'll just aspirate the central capsula right away. So this is a straightforward approach how to deal with the capsula. So you see the capsula is at the tip of this phaco machine. So if you push the foot switch, so it's gone. And the next step is phaco aspiration of all those quadrants. So we didn't use any ultrasound, and quite for sure the procedure is a little faster if you compare that to the classical ultrasound way. And the next step is IOL implantation. So we are just coming from the temporal side on the ST meridian, getting this Physiol IOL ready for the implantation, and it just came in very nicely. So the next step is just to rotate this IOL, clean up the capsular bag very thoroughly again. Lens well centered, we just everything clean up very nicely. Once again, this is a Stellaris PC with its handpiece, and we are getting it inside, and we'll just aspirate the central capsula right away. So this is a straightforward approach how to deal with the capsula. So you see the capsula is at the tip of this phaco machine. So if you push the foot switch, so it's gone. This is the conclusion of this surgery. So thank you very much, and enjoy the rest of the Congress. For those of you joining us at the internet, please, you are welcome to stay with us for the next surgery, which is going to be conventional ultrasound cataract surgery with NV-style implantation. Have a nice day. Goodbye.